maybe there's something wrong with me. I think at one point I was like, maybe this isn't the right diagnosis.
Hi, everyone. Welcome back to this week's episode of Take a Pain Checked. I'm your host, Natasha, and I'm excited today to have a conversation with someone who brings clinical expertise and lived experience to the autoimmune space. Joining me is Dr. Singla, who is a triple board certified physician who specializes in pediatric rheumatology and integrative medicine. Her story is really unique because she was diagnosed with rheumatoid arthritis after becoming an attending rheumatologist, a journey which led to a few career pivots. She is the founder of Room to Grow, a private medical practice in Houston, Texas, and she blends conventional rheumatology with integrative medicine. So, hi, Dr. Singla. I am very excited to have you today. Can you start off by telling me a little bit about yourself, your education, your background, and what you've been up to recently?
Yeah, hi. Well, thank you so much for having me, Natasha. I really appreciate it. My name is Dr. Singla. I am a pediatric rheumatologist. So after finishing medical school, I went off to do 3 years of general pediatrics. And then during pediatric residency, the cases that always were the most interesting to me, or the ones I thought about after a long day, were the rheumatology cases. And I think it was the perfect blend of kind of having this cerebral hat on of like, ooh, what could it be? Like playing the Dr. House game, and then also just the pathology of immunology and like the nitty gritty science I really liked as well. So that kind of led me down pediatric rheumatology. I have grown up in Houston my whole life. I was actually born in India, but then moved to the United States when I was little, like kindergarten. So pretty much raised in the US, grew up in Houston, went out of state for my training for general peds, and then came back. And really, since coming back from for fellowship training in pediatric rheumatology, I haven't left since then. And so my life and my home are all Houston based here, but I work and talk to a lot of people from across the country and across the world as well. And integrative medicine kind of came into my life after. So I finished my fellowship. I became an attending, and that's just a big word for you're a full-grown doctor. Like you've done your training, you have your hours and everything. And so after becoming an attending, within that first 6 months or so, I started to develop symptoms of RA, which you would think, hello, like someone who treats RA, it's obvious that you're having stiffness and fatigue. But I was like, it's probably like just from having a kid and stress. And then eventually that led to going to see the doctor and the RA diagnosis and denial and everything that comes afterwards. And, once you become the patient with this condition, it really changes everything. It really changes everything. Like you realize the medical portion of it is just so small compared to the big piece. And so things like what I'm eating, my relationships, what I'm doing for a living, how all these little things day to day adds up. And so that led me down more of the integrative lifestyle education pathway as well, where what am I supposed to be telling people when it comes to diet or sleep or stress? So that's kind of how I ended up blending both worlds. And now we're here. I started my own practice now 3 years ago, I think, in 22. And so it's been a learning curve. I call it my third fellowship. But it's been great, and it's just a really wonderful way to help patients outside of what I was already doing before this.
That's amazing and so great to hear. You were diagnosed with RA after you did all your training. So, like, why did you choose to go into medicine and rheumatology in particular if it wasn't specifically because of your arthritis, because you didn't have
Yeah.
arthritis at that time?
It's a really great question. I think so. I was a biochemistry major in college, and so I loved like super detailed stuff, like what's attaching to the receptor, what's happening afterwards. And so I felt like rheumatology explained stuff from like the molecule level down all the way to what you're seeing in clinic. Like you could track everything back to like one small micromolecule. And I thought that was just so fascinating. And that you could treat people based on that was really, really fascinating to me as well. Also, like you follow these patients for a long time, a long, long time. Like you meet them when they're itty bitty and then they graduate and they go off to college. You're like, okay, we got to find you an adult doctor. And it just feels like, oh, it's like saying bye to like a close family member. You're like, I'm here, but I won't be seeing you all the time. And so I like that connection of being with the family, kind of seeing them from when they were at their worst to going through the roller coaster with them and then sending them off basically to the adult side.
So can you take me back to the moment where you've received your diagnosis and how did it feel to be on the patient side of the exam table?
It was terrible. It was just like, this is what it feels like. I mean, it was like, I think I'm trying to remember now. The doctor came in, she felt my hands, and she was like, this is a very bread and butter, as you know, diagnosis. And in my head, I'm like, okay, but it's still the rest of my life. Like it felt very minimizing, which I'm not saying you need to like catastrophize the diagnosis, but it felt very like, this is what it is. This is what you need to take. Start it. We'll see what insurance says. I'll see you back in 3 months. It all felt very fast. Like I was just like this piece going through a conveyor belt. And so it took a little bit to process with the words that were coming out of her mouth, the fact that you have this long-term, lifelong diagnosis, and we don't know what the picture is going to look like, but this is kind of what we need to do now so we can stop bad stuff from happening later. I had to process all that in my head together. And so it was all very fast. And I was in a little bit of denial even after getting it. I was like, there's no way. She doesn't know. There's no way. And that's what it was. This was the diagnosis.
Were there any assumptions that you used to make as a physician that kind of changed once you became a patient?
Yes. I think as a physician, like when you're pouring your heart out into explaining, especially a new diagnosis to a family, like parents in my case, I'm like, "Ah, I did a really great job explaining it. Like, good job. Like all everything. And then they come back and they ask the same questions. You're like, but I thought I answered that because you don't realize how much is thrown at you at that first visit. So I literally slow down now and assume that even if I just said it, that maybe you didn't understand it. And not in a bad way. It's just a lot to take in. It's a lot to take in. So then I give more bite-sized chunks of information. So then, and I also give information at the beginning of like a new diagnosis packet in a book that I kind of wrote to the patients, so they know what it is and they can be reading that outside of the clinic visit as well.
Did you join any support groups where you're like, I can navigate this myself because I know what it's kind of like in a way because I'm studying it? Like, what was going on in your mind in terms of like the emotional aspect?
I think I ignored it, to be honest. My logical brain was firing away those first few years, I would say. I didn't lean on anybody except my husband who knew what was going on, obviously. I was just like, you know what, this is the path, this is what I'm supposed to be doing. This will all go away once the medicine kicks in. And it's like, okay, biologic one, biologic two, biologic three, like nothing is working. And so at that point you realize like, okay, it's not as straightforward as I thought it would be, and I probably need a bigger tribe to lean on to find acceptance for what's happening.
You just can't believe that it's happening to you. It's really hard to kind of accept it and it takes time, but I feel like over time we've been able to kind of accept it and adapt with
Yeah,
it. So, what
yeah.
surprised you the most about navigating the healthcare system as a patient with a rheumatic disease?
The insurance prior authorization drama, let's call it, of I can't believe you're asking me this. This should be written somewhere in my records, but nobody is reading it. Or why are you rejecting this medicine? I've failed at this. Why am I having to feel worse for this medication to be approved? Like, and how much time you spend on the phone. Like, even as a provider, we're not taught like medical jargon in terms of ICD-10 codes and like what you need to say to insurance companies. What is a copay card, this card, like who do you call? The copay company is not connected to your insurance, like they don't talk, you're the person that connects everyone. I didn't know any of that back end stuff from prescribing in the computer to the medication being shipped to your home. Like there was a huge gap in knowledge there. So that was very new for me.
What was your medication journey like when you were diagnosed now, and how have your symptoms changed?
At the beginning, I think it was like Plaquenil, methotrexate. I just kind of kept going up the ladder. Started here, and then okay, well, the DMARD or disease modifying anti-rheumatic didn't work, so now let's try going up to a biologic. So I started with Enbrel. I think Enbrel worked for a little bit, and then I failed that. Went on to Humira, Orencia. What else? Actemra. I think I failed Xeljanz or tofacitinib. So there was all classes. I was just like, oh my God, why is it's me? It's got to be me. Like the data shows that it should be helping all these people. But for me, it's just getting like partial response and not full response, which is what the goal is for everybody. So that was really, really frustrating, I think, to feel like maybe there's something wrong with me. I think at one point I was like, maybe this isn't the right diagnosis. So, but my rheumatologist was like, "This is the right diagnosis. I think we just haven't found the right medication for you."
I feel the exact same way. I've had such a long medication journey as well, and I've been like, okay, well, maybe I don't have arthritis, but then I actually feel the symptoms, so I'm like,
I know.
I do. It's just like the medications are just not lining up, just taking a longer time. So I totally understand what that feeling is like. You have been through this journey living with rheumatic disease. You're also a physician. Can you talk a little bit about Room to Grow and how your practice is different from other practices, or what your journey was like
Yeah.
getting to make that practice?
For me, I always thought I would live and die in academics. That's really where I thought I love teaching residents, fellows. So that I was kind of enjoying that aspect of it. But then when I had my own diagnosis, I realized that in the setting that we're in, you're only capable of moving the needle so much for the patient. Yes, obviously you want to get disease activity down to zero. You want to utilize all the medications you learned about during fellowship and training. But there's this huge gap in care in what I was able to do in terms of counseling and education when it came to like the 80% of your life that I'm not going to be with you for every day, right? Like what you're eating, how you're sleeping, how you're moving, your stressors. So once that thought kind of seeded of like, wouldn't it be cool if dot 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 like I could have a practice where I can address the medical part, but be a resource for patients on what they should be eating or not eating, things like that. Because there's a lot of like misinformation out there, and people do a lot of DIY stuff. Let's just put it that way. So I wanted to be kind of a sound center to be like, you could do the take these medications, but also at the same time make sure you're doing this, this, and this. So that way, I really feel like I'm giving my all in terms of my knowledge and my time on how you can be living your best life as much as possible. So that kind of seeded the thought of like, okay, maybe let's think about this. And then once you start a thought like that of when we start my own practice, it doesn't go away. So that was kind of the birth of Room to Grow. And honestly, it took me a year to leave the place I was at before, and it was a very slow exit. And during the time we have something called a non-compete where you can't practice within a certain time frame of where you were before. So during that 1 year, I kind of developed handouts, resources for patients, like what am I going to say, different topics to cover from a lifestyle angle in terms of what am I going to teach these people that I'm not doing already. So I spent a lot of time on the education component and still do in clinic, modifying things. And so that was kind of the birth of Room to Grow. And since then, we have pivoted to now with like a nutritionist, we have a health coach, physical therapist, like everything in kind of one house for what patients with rheumatic diseases might need.
Are you the only rheumatologist in this practice, and then you have other healthcare professionals help you out?
That is how it is currently. Obviously, as the practice grows, the thought is to grow the providers and doctors as well. But what I do is so niche that it's hard to find a pediatric rheumatologist who wants extra training and all this other stuff, or even has interest in this other stuff, to be able to sit and join me. So that's kind of the challenge right now. But slow and steady. I am not in a rush to become the next anything. So slow and steady for me.
Do you find that patients like the holistic side of things, or like the integrative medicine piece when it comes
Yeah.
to that healthcare? Like, have you had any experiences where patients are just like, we want just the medication aspect, or are they pretty open to everything else that comes with the
Oh my God,
disease?
they love it. They love it. They're like, no one's ever asked me that. I'm like, no one's ever asked you what you eat for breakfast and lunch and dinner. And it's like, no, because I think they feel like, oh my gosh, someone is addressing the stuff that I think about, but I don't have the time to ask, or just, for whatever reason, they don't talk about it. So they feel almost like, I think a lack of a better word, complete coming out of the visit, where it's like, okay, we addressed everything that was on my mind. And you have a better direction in terms of what you're doing when you step out of the clinic setting is like, is this helping or hurting me, basically. And so people love it. I've never had one person be like, just talk about the medications, please.
I know.
So
I'm like, I wouldn't say that either. I would want everything. I'm like, but maybe there might be people out there.
maybe I don't see them. I mean, I'm sure there are people like that out there, and they know my practice is different from the
Yeah.
beginning, so I don't see them.
So there's a lot of talk on like functional medicine and integrative medicine. People confuse that. Can you explain the difference or similarities between
Yes.
them?
Yes, I think a lot of times Integrative and functional get like mishmash together. And functional is different than what I do because functional medicine uses the term, I don't know if you've heard of it, like root cause of an illness. And so for me, it's like when you're talking about an autoimmune disease, it might have been triggered by something obvious like an infection or like an illness or something, but we can't take that infection out of you. You still have the disease now, right? So what I always say is instead of searching for one root cause that I know when it comes to immune system dysfunctions, like doing certain supplements or eating a certain way, it's not going to be enough for the majority of patients, let me say. It's not going to be enough to course correct the entire immune system to put you into remission and then maintain you there. I mean, that's a big, lofty goal to kind of retrain your immune system. And I don't think isolating one cause that may have lit the fire of inflammation is going to be the reason for that. So in functional medicine world, they do a lot of testing, whether it's genetics or blood work wise, looking at what potentially that root cause can be. They also address the lifestyle stuff too. They do that part with the root cause testing. Integrative medicine is using more of it's just think of your toolkit of therapies for RA or JIA or whatever it may be. Is you're using the conventional side, but we're not in the back of my head, I know that I'm not going to be opposed to using medication. In fact, it comes to the first, line of defense in terms of treating the disease early and aggressively as possible, with the hope that, hey, if you're doing all the lifestyle stuff, your risk of comorbidities, having a inflammatory condition later down the line is going to be lower, like heart disease, hypertension, stroke, all that kind of stuff. So if you're doing the work on terms of going to bed on time, eating, like trying to be your best in terms of eating the right foods, minimizing stress, maybe doing acupuncture if you like that, some sort of stress management technique. If you're doing all of this in the background in addition to taking your medication, it kind of hopefully sets you up for being able to wean off the medication or at least being on maybe on a lesser dose or lesser frequency. So because we always want to be on the most minimal amount of anything, including supplements. So it's doing the work up front so you can kind of not have to play defense mode later down the line.
Thank you for sharing that. How do you decide which tools to use in a specific patient's care?
That's a good question. It really depends on the patient and the family because there are some families that I see where diet is their main concern. They're like, we will do anything to not have to use medicine XYZ. And so I have to tell them like that's a lofty goal again, but this is kind of what the data shows in terms of Mediterranean diet, anti-inflammatory diet. There are other patients who are like, we play baseball till 9 p.m. We have to pick up McDonald's or Chick-fil-A and then eat that in the car and go home. Like that's our dinner. So I kind of have to meet them where they are in terms of, okay, well, how many times a week are we doing that? How are we offsetting that? We just have to kind of figure out what works for you lifestyle wise because it needs to be sustainable. It's not something you can do for like 2 weeks and be like, well, I tried, tried eating well, it didn't work. So I just have to meet patients where they are and hear their story.
So how do you kind of tailor that to the patients, or can you give me an example of a specific food that you recommended or diet or lifestyle? Like how would you go about that when you see a patient in clinic?
So again, it depends on their activity level and kind of where in my head when I'm thinking about the pillars of lifestyle medicine, it's going to be your diet or food, stress, sleep, and movement. That's kind of like the basis. And so I rank those four into what do you need the most help with to help kind of decrease this what I call subclinical inflammation or like maybe adding fuel to the fire for the bigger picture. So for a lot of people, I it's stress is a big one. Poor sleep hygiene is another one. Nutrition is definitely a big one. So if someone comes in and tells me like I've eliminated gluten and dairy and corn and soy and eggs and I'm not, I feel the same. It's like, okay, well, we're going to slow down for a second because I don't think it's sustainable to continue being off that forever for a child slash adolescent. So then we say, I usually get the health coach or nutritionist involved at that point because I want to work on reintroducing those foods. Because the key is in guiding people in terms of how fast to reintroduce foods, which foods you're going to reintroduce first, and then what to look for. So I can't just be like, well, just restart everything and we'll see if you get any symptoms. We need to kind of pinpoint it and figure out, okay, when you eat gluten, Nothing happens. Okay, so it's probably assuming that we can, over the next couple of weeks, get back to eating gluten and then monitor our body. And then we'll kind of do it step by step based on that. So I make the rank list of where in the pillars they need the most help. We do the most work there. And then after I follow them up every 3, 4 months, I'll ask them like, okay, well, what do you need help with now? The top two is going to be stress and food for people by far.
I think that makes the most sense because, like, a lot of us younger people, or and even older people, always stress because of something or the other, and I feel like stress doesn't stop. So,
It also like social media, I will say, has been very stressful for people, even though it's supposed to be like a social setting. A lot of comparison sets in because when you're a child with JA, the last thing you want is to be different, right? You want to be a fly on the wall. And so when people are asking you, like, why does your knee look like that? Or why do you have to go to the doctor so much? Or why do you have to take that medication? That's stressful too.
I'm assuming to get all this like data and extra information, you run some labs. What
Mhm.
kind of labs do you run that conventional kind of like, I guess, what kind of labs are you running that maybe other clinics don't run? If there anything, is there anything that's different?
It definitely depends on the history, and a lot of it depends on the diet history. I will usually broaden the nutritional, like the micronutrients. I'll test for those. Like it could be an iron or vitamin D, sometimes B12 or folate if you're vegan, vegetarian. I have a good handful of those. A thyroid level if I feel like that needs to be checked. I'll do a celiac workup if I feel like that, hasn't been addressed. So there's multiple different. I can probably guarantee you that I will be doing some additional lab in addition to the I will be doing some lab, number one, but in addition to the rheumatoid factor, ANA and HLA and all those kind of things, I will be probably testing kind of, do you have any deficiencies that we need to optimize, especially vitamin D. So when it comes to vitamin D, a lot of them have been low. The ones I've tried, I think the lowest one I saw was like 5 or 6, and the cutoff is 30 and above for normal. So that, those have been by far the most deficient in terms of micronutrients.
Yeah, I mean, even for me, I feel like vitamin D, especially in Canada, it's
Oh yeah.
like we're not getting the best sun out here. So yeah, it's definitely something that my mom's always like, oh, like take these vitamins, and it's just like an extra pill to take. So I'm like, I don't really want to, but I know it's
No,
good and we should be doing that.
I know. You should periodically probably get that checked. The other thing I also recommend is before supplementing with like a vitamin D, I like to know where the level is to know how much to supplement. Because if you're deficient, the treatment for that is different than, oh, you're just a little bit deficient.
What signs of burnout, did you face and did you ignore them? If you did, how did they kind of show up and you're like, oh, wait, I'm actually feeling burnt out if you did?
Yeah, I think that's a great question. Burnout presents itself differently for different physicians in different specialties. For rheumatology, it's a lot of behind the scenes work with families in terms of insurance companies, like writing denial letters of medications and stuff. It really eats away at your soul. In the US, we have to write these beautiful letters that say, like, this patient deserves to be on a biologic, even though they haven't failed a methotrexate because they have really severe disease, and we have guidelines saying that that's okay, but the insurance company at the end of the day is almost as if they're practicing medicine and saying like, no, we're not going to allow for that. So that is a big component of chronic illness care in general. Like us, endocrinologists, neurologists, GI doctors, I think a lot of us face the same type of fatigue when it comes to that. And then also these visits, there's a lot to address in one visit, and it can be very overwhelming. And you just you're like this battery that walks, think of yourself as this unit of energy, right? This battery that's full. And then by the end of the visit, you're like all the way to the end because there's just so much to cover, and you give so much of yourself to these patients as well. Because most rheumatologists are we are invested in our patient's health. We want them to do well. So when you approach it like that, it's you invest a lot upfront emotionally and physically and mentally. So I think that can create a lot of burnout for physicians in addition to the insurance mumbo jumbo that we have to deal with.
Are you currently doing any research or going to conferences to staying like up to date with the rheumatology field?
Yeah, so I try to attend American College of Rheumatology. every year, every other year. Sometimes it's hard to go every year. I am going this year. I'm giving a talk on kind of how I transitioned my practice from what I was doing to what I am now. I'm also part of the where I did my integrative medicine fellowship at University of Arizona, the Andrew Weil Center for Integrative Medicine. So I help write the juvenile idiopathic arthritis section for that as well, educating people. And I get a lot of in like requests for people to come shadow me. So sometimes if the timing works and it makes sense, then they're just literally sitting with me in the clinic watching the whole encounter. And my clinic visits are very long. They're about 2 hours for a new patient visit. So, I see the students like vigorously taking notes in the corner, and I enjoy that part. I do. And so I'll give them papers, and I still love the education component, even though I'm not in an academic center.
That's nice that you're still kind of incorporating that with your new practice. That's amazing. What does the ideal medical care look like for a young person with a rheumatic disease?
I think I asked myself this when I was starting my own practice of like what on the other end being the patient, like what are my pain points? What did I want answered? And I think good care is A, getting a physician who listens, not just selectively listens to what you're saying, right? And they get the right diagnosis, they get the right medication going, obviously, or at least trying to get the right medication going. But then also they're listening to the lifestyle stuff to make sure that you're doing everything on your end. Like it's not just me doing everything for you and to you. You need to be pulling the weight a little bit as well as the patient in terms of the lifestyle stuff. So I think when you do like a whole 360 approach to it, the medical term for it is a biopsychosocial model. We want to make sure we're hitting every single point in those. Right. And it doesn't need to be in one visit. I think that's where people get overwhelmed. It's like, well, I don't have time to do that. It's like, well, pick one thing and talk about that. And so we kind of split that lifestyle stuff up. Obviously, it's heavy at the first visit where we do try to address every single one, but then over a year or two, we make sure to cover every single pillar in more detail.
Are there any misconceptions that you think people have about this integrative or holistic medicine in rheumatology, whether it's like other rheumatologists or patients or families?
I think the word holistic can mean different things to a lot of different people. I think that's where the problem is. So when I say holistic, I think of like comprehensive is like the fancy word for it, right? I'm not saying parasite cleanses, only doing alternative therapies or this. For me, the definition of holistic is kind of addressing all your needs, medical, mental, physical, all of it. For a lot of people, even in my own field, I had so much imposter syndrome and still do in terms of, oh, you're integrative, so you must not do medications. Like I think there a lot of patients come to me thinking I'm not going to talk about medications, and that's not it at all. For me, when I say integrative, I'm literally integrating or combining the best of every single thing out there. And yes, there's not like double-blinded, randomized controlled trials for like acupuncture or use of different supplements. But for me, what I always think is, okay, we have the medication going. You need a little bit more help in terms of symptom management. Why don't we try something like acupuncture that has low risk but potential benefit? It's not going to interfere with my medications or cause adverse effects, and it has the potential to make you feel better. So, yes, I'm going to recommend that you do it. And I'm monitoring you, right? That's the biggest thing is I ask for patients to be honest with me. If you're trying something new or a new medication or a supplement, let me know because a lot of the supplement world is not regulated by the FDA like our medication. So people do a lot of stuff on their own. And so I'm always like, please tell me. I'm going to be honest with you, but I will not judge you because I've been in your shoes. You just want to feel better. I get it.
So you also have a platform, you've created Room to Grow. How do you use this platform to educate and empower other physicians in private practice or leadership roles?
For physicians, I think they're always reaching out to me to be like, what is this setup? Like, give me the protocol for how you started your practice. And I'm like, well, I don't really have one. I just kind of, because I didn't have somebody in the world of pediatric rheumatology who was doing what I do. So I kind of created this framework of my on my own, like what I talk about in the clinic visit, who all needs to be involved, like how do we help patients get from here to here in their care. So a lot of times people just cold call, reach out to me or email me asking, pick your brain is the term that most people put in the email. And sometimes I have time for that, sometimes I don't. If I don't, I'll say like, what are your what are your specific questions? I think for most people, they are interested in a model like this because everybody wants to help patients, but it's like, how do you carry it out? So for most people that come to me from the medical angle, that's what they're asking me about. Patients come to me, they find me on social media as well. Um, I not being in an academic center, it's not so easy to just have like, we don't have my internal IRB to go through research and stuff. So one of the things I am looking forward to doing is finding somebody to collaborate with, and that's in the works in terms of collecting data on how long people are on these medications if they're able to start doing lifestyle stuff earlier on than later.
Where are you getting your patients from? Are they like coming from social media or the internet or like
Yeah.
referrals through hospital? Like where do you find patients for your
I
clinic?
would say all of the above. It's a lot of word of mouth, or second opinions, or like, I have nothing against second opinions. Like I always tell the patients, like, let's go. My role is to kind of be one and done. Like if you're getting the care that you need, my job is to say this is what else you need to work on, and then I send you right back to your regular rheumatologist. So sometimes I just serve as kind of that one and done consult. Uh, Word of mouth, social media, Google. I mean, people find me in so many different ways. And that's something that's taken time. Like at the beginning when no one knows who you are, all you can do is just do a good job and see your patients. And hopefully, they'll say good things. And so then it starts to kind of snowball after that.
Yeah, that makes sense. I mean, for your own arthritis, do you find that it's well managed now?
Oh yes, I'm finally off of methotrexate. I was on combo of biologic and methotrexate, and it took years to get to this, a decade almost to get to this point of I have a better sense of what my flare triggers are, of what I need to be doing to listen to my body, how I need to get to bed on time, otherwise we're all going to suffer. Those type of things is me learning the disease and the disease learning me. We're both at a good place now.
Did you find that even when you were studying or working, your RA was hard to manage and like interfered with your job?
Definitely 100%. Like I didn't realize that because I wasn't addressing this other stuff, I just kept like asking the rheumatologist, like, what else can I do? Do I need IV meds now? Do I need to add more? Can we be on three at the same time? Like, and the reality was that the work needed to be done with me to figure out what I was doing to fuel that inflammation. And so for me, stress was a big one. Sleep was a huge one as well. Like whenever you're on call at a big hospital, you're going to get woken up at night. And so when you're doing that for 7 days in a row and then getting up, multiple times throughout the night, I didn't feel great the next day. And I just thought, oh, it's, from waking up. And I was like stiff. Then I'd be on steroids for weeks after being on call, and it would happen again in a couple months. And so I finally put the patterns together. I mean, hindsight is always 2020, they say, but finally put it together to be like, no, I need to stand up for myself and just get to bed at a certain time and do the best I can. That's kind of how it went.
Do you find any like go-to coping mechanisms for your chronic illness?
There's different types of coping. Some of it's emotional, mental, some of it's more physical. So on the days that I do feel achy, let's say traveling or like waking up from being on call, now I know like get like something heated, a hot bath, hot shower, something, a paraffin dip. I have one of those on Amazon where I can like dip my fingers in. So I have more like my arsenal is stronger now and I can pull the trigger sooner than later. I used to wait till things got bad to do something. Now I already know like, okay, I'm going to be traveling. Okay, I'm going to be doing this, or I have something stressful coming up. Get ready. So I already have everything out, laid out, ready to go. So it's more of me knowing what my triggers are, how to manage it faster, so it doesn't get to the point where I'm on steroids and potentially needing more medication.
That's great. Yeah, I know. It's like so good to finally find ways to manage your pain. I feel like oftentimes we only like think about the medication, but not like how to manage your pain. So I'm glad that you're focusing on that in your practice because it's not just let's go on medication. Like that's amazing and it's going to help us, but it doesn't help us like tomorrow or the day after.
No, and I think in a rheumatologist's mind, like if I put on my rheumatology hat, it's like, you're hurting, here's some naproxen, here's some prednisone, here's, like this will make it all go away. But it's going to keep happening because there are certain triggers. How is a rheumatologist supposed to know your whole life story? Like you have to figure that out yourself on what your day-to-day stuff looks like. So that's why I'm saying, like, I do heavy lifting, but you have to do the heavy lifting as well in terms of putting those pieces of the puzzle together. And so that's a lot of it is in education and you start to realize it after you're on the journey for a couple of years. You're like, oh yeah, I do hurt when I do this. I probably shouldn't do that.
Yeah, no, I totally agree with that. And so I wanted to play a short game. It's called The Future of Medicine that we created. So I'm going to give you sentences, and you're going to tell me what your dream would be for where medicine is headed. So the first one is doctors will spend blank minutes per patient.
Are we talking about a traditional setting, like a regular doctor's office?
Yeah.
Not room to grow.
Yeah.
Okay. In the world of pediatric rheumatology, I'm going to go with 25 minutes.
And the
25
dream, and the
minutes per
dream
patient.
would be, what would you want? You want them?
Ooh,
Yeah. Well,
the dream would be like if I know you, maybe an hour to be able to cover everything. If you're a new patient, it does take 2 hours to go over everything. So that is ideal, but not realistic. I understand in every setting.
I know. I feel like I've never had a 2 hour doctor's appointment before. Even 1 hour. I think an hour. I still don't think I've had that,
Oh,
but it is the dream. Kids with autoimmune diseases will feel more blank.
resilient.
Yeah.
Resilient mentally and physically to know that like this is manageable. There are other people in front of you that have done this and you can do it too.
Okay. Next one. The one thing we'll be testing for that we aren't today is
Biomarkers. That's not like a lab test that hasn't been tested yet, but like validated and all that.
medical education will finally teach blank.
Lifestyle.
And then the biggest myth patients still believe is that.
Think that when it comes to autoimmune disease, that they're going to be cured or it's going to somehow be reversed. Unfortunately, I was in that boat as well. It's going to be with you like a body part.
So I wanted to end off with an advice segment. So what are your hopes for the future of pediatric rheumatology, and what do you think will let us get to that point?
Hmm. I think the future of pediatric rheumatology, my hope for it is that medicine turns to the fact that medication plus the lifestyle stuff really is what helps people the most. So whether we need more data on that front, supporting research that does that, allowing providers to have clinic time, space, and resources to help people, not just choppy, siloed care, and a team multidisciplinary approach that makes sense for the patient and the doctor, right? Not to burn out. I think time was what's going to help us get to that point, gather more data. Um, if not data, at least patient experiences and patient, like their outcomes, basically, of how they're doing. So we don't want to see anybody in a wheelchair. Like that should be a thing of the past, you know. So no, ideally no joint contractures, nothing like that in children, because we want to catch it, get medication involved, do the lifestyle stuff, so they can go on to graduate and pay their taxes and get married and all that kind of stuff.
Is there anything else you'd like to share with our listeners today?
I think the biggest thing is, you know, if you're a parent listening with a child that has an autoimmune condition, I think never stop feeling like, did I do everything? Like if any part of you feels like that, please reach out to our practice, any practice to get kind of the needs that you're looking for, whether it's lifestyle related, education related, resources related. Don't be afraid to reach out. And then also know that you are doing your best for your child, and everybody's story is going to be different. So do not play the comparison game where, well, this person went gluten-free, so how come we're not getting the same results doing that? That is a dangerous place to go, to let your mind go. So focus on your own journey, understand your child's triggers, flares, when they do well, when they do bad, and know that you're doing the best you can.
Thank you so much, Dr. Singla, for joining me on today's podcast episode. Your journey from specialist to patient to innovator really shines a light on what's possible when we reimagine healthcare with empathy, science, and the whole person in mind. For listeners, if there's a one thing to take away, I hope you can carry forward that taking care of yourself is not just about prescriptions and lab results. It's really about having a care team who truly sees you, listens to you, and empowers you to be an active part of your healthcare. Everyone, make sure to like, comment, subscribe. Check out Dr. Singla's social media channels, which I will link down below, and I'll see everyone next time on Take a Pain Check. Thank you so much.